Hello, my name is Michael Lunzer, and I'm the CEO and founder of Itiliti Health. We are focused on helping payers streamline and automate their prior authorization processes. Today, I'd like to talk with you briefly about upcoming regulations that are proposed by CMS and what you can do now to become compliant and at the same time achieve a return on investment even before providers adopt the interfaces that are necessary to fully achieve the capabilities of these new regulations. This is a chart that shows the typical steps of achieving a prior authorization. It starts with a provider creating an order for a procedure. It's then passed over to an administrator at the provider organization to schedule that procedure. They typically also go to the health plan's website to determine if a prior authorization is required for that patient on the particular date of service. They might also look at the health plan medical policies to determine if the patient has met all the prerequisites necessary to become approved for that prior authorization. The administrator then pulls the necessary documents and submits that prior authorization. On the payer side, a clinician looks at the medical record and compares it to the medical policy to help determine if that procedure can be approved or needs to be denied. There's been a tremendous amount of pressure from regulatory agencies to try and improve the prior authorization process because of the delays inherent in all of the manual steps that I just went through. There have been federal efforts, state efforts, things like the Texas Medical Association, Texas Legislature's gold carding regulation that was heavily supported by the Texas Medical Association. The AMA has put a tremendous amount of pressure on the government to try and fix prior authorizations. And the regulation we're going to talk about today has recently been proposed by CMS. And essentially, it's called the Advancing Interoperability and Improving Prior Authorizations Processes. It's rule number CMS-0057P. It was proposed December 6, 2022. Comments were required by March 13th, 2023. And assuming it's adopted, compliance will be required by January 1st, 2026. Today, we're going to talk about one specific aspect of this regulation, which includes a requirement that impacted payers implement and support a FHIR-based prior authorization requirements, documentation, and decision API, nicknamed PARDD. I'm not really sure why they called it a PARDD because it doesn't seem like a party. Essentially, there are three transactions identified in this specification. The first transaction is the Coverage Requirements and Discovery, or CRD transaction, and is essentially where the provider is given the opportunity to, through their system, ask, is a prior authorization required? The second transaction is the Document Templates and Rules transaction, also called the DTR. This is where the payer will provide information back to the provider as to the rules for a particular procedure's prior authorizations, what data needs to be submitted, and what are the requirements. And then lastly is the prior authorization support system. And this is an API that allows for the submission and management and tracking of prior authorizations that have been submitted. One of the challenges we have is that today, health plans support these first two transactions with pretty rudimentary tools. Is authorization required is oftentimes supported by spreadsheets that are published on the health plan website, and they're not very effective at helping to determine if a prior authorization is required. In fact, usually provider resources pick up the phone and call the health plan to ask, or they'll just submit a prior authorization that's not needed. The second transaction, the DTR, is today supported by hundreds of PDFs that the health plan publishes on their websites and makes it really hard for the provider to know which PDF applies to my particular procedure by the date and line of business that's being used. And then the third transaction, prior authorization support, or PAS, that's typically supported today through the care management or workflow tools of the health plan. So as you can imagine, PDFs and spreadsheets are not going to work as we look to automate this process. What's needed from a health plan perspective is a comprehensive prior auth rules database application that can store all of the various rules for the different lines of businesses and products within each line of business and all the permutations of those. Also keeps track of which changes happen on which dates. The next component that's required is a medical policy database application. This application breaks down medical policies into the different aspects of documents and templates and various rules and even questionnaires that can be submitted back to the provider. And then the last piece that's needed, because again, care management and workflow tools currently support most of the processing that goes back and forth, but there's a need for a decision application that takes in the information that's been submitted by the provider and determines yes or no, this prior auth can be approved, and if not, who gets to look at it within the health plan to make a better decision if automation can't complete that process. So as laid out, this new standard for prior authorizations will automate prior authorizations between payers and providers, and that's a wonderful idea. One of the challenges, however, is that we don't have a world where all providers are going to support these new specifications right away. So payers are going to have to continue to support telephone and fax-based prior authorization activities and web and portal-based activities in addition to the FHIR server. So there's good news. Itiliti Health has created a product called PA Checkpoint that supports the coverage requirement discovery or ISAuth required transaction. The payer's call center can access PA Checkpoint to answer the ISAuth required question for providers that call via the telephone. PA Checkpoint is exposed to providers directly through the website or the provider portal. And PA Checkpoint can support transactions submitted to it through the FHIR server. So implementing PA Checkpoint is a compliance initiative and at the same time generates a really significant return on investment because we eliminate a tremendous amount of telephone calls because now providers can self-service through the web and get a confident answer. And we shorten the time for telephone calls that do come through because the health plan's call center can answer questions quickly because they have an accurate, comprehensive source of truth that they can get to for whether or not a prior authorization is required. The next product Itiliti Health has created is called Policy Management, and this product supports the DTR, Document Requirements and Templates transaction. Again, similarly, providers can get to the same information through a web portal or through the website of the health plan. The health plan's call center can access this tool and can use it to provide accurate information back to providers. And policy management can support the DTR transaction within the FHIR transactions. And lastly, Itiliti Health has created a product called Clinical Assistant. And this supports the decision. This is the decision application for the prior auth support transaction. And again, providers can fax in medical records. They go through an OCR process. The care management system assigns a case and passes those records to Clinical Assistant, which performs the decision process. Similarly, when prior auth submissions are provided via the web or a portal, those same documents can go through an OCR process, and Clinical Assistant can ultimately help make the decision of whether or not that prior auth can be approved. And of course, in a FHIR instance, the care management tool can send those documents and other artifacts to Clinical Assistant, which can help make that decision and automate the process. So in summary, Itiliti Health has three products: PA Checkpoint, that is a very good repository of prior authorization rules and information for the health plan that can be exposed to support the CRD transaction, as well as providers accessing our tools through the web. Policy management can be used to support the DTR transaction and can be made available through the web. And clinical assistant can help health plans make decisions around prior authorizations in an automated fashion and can be exposed to prior auth submissions that come not only through the new standards, but through the traditional means. The last step is for the electronic medical record system companies to support these standards. And at that point, we'll have full end-to-end automated prior authorizations. Just one more note, Itiliti Health has a full suite of products, a number of products I didn't talk about that help automate and streamline prior authorization processes for payers. We'd love to talk with you about those in more detail and would appreciate it if you'd reach out, and we'd be happy to schedule a time for somebody from our organization to walk through the products in more detail and talk about how you might take advantage of our streamlining and automating of prior authorizations. Thank you for your time today.